Hey, thanks for joining us, Digital Enamel. Check out Digital Enamel TV. And Cindy and I, we want to talk about matching a single central.
Yes. They say that's one of the hardest things to do in dentistry, and we've all heard that for so long. But, you know, if you know the few things to look for, it's actually not that hard.
No, the more of these I do, I mean, they're not easy, don't get me wrong.
Right.
You got to kind of have an idea, and we're going to go over a couple materials to at least consider. But matching a single central, it's one of those things that we have in dentistry that is just the phrase that continually goes generation of dentist to the next one.
Right.
And do you know where that phrase came from?
No, but I mean, when I think about it, it's kind of based off of, I mean, we're still talking like lab days,
Yeah.
you know, and you're just taking a picture. You're not saying, not that there's anything wrong with lab days, but, you know, one visit dentistry is different. So,
Yeah.
you know, your cameras are good, but you're sending a picture, and it's really tough for the lab to try to, you know, look at a stump shade from a photo. And then what am I going to use to block that out? Is that really opacity or translucency I'm seeing in the adjacent teeth or whatever? So that kind of makes it hard. But when we're seeing it with our eyes in the chair, you know, I think things has changed throughout the years in materials.
Well,
also.
like in the history of materials, we had PFMs.
PFMs.
That was
That
it.
was it, yep.
And what are PFMs? They're very opaque. So if you look at this picture, just in this case, I mean, obviously the shades are off, but it's not the shade. It's the difference between translucency and opacity.
Yep.
In another video, we talk about how zirconia, I know zirconia is all super sexy and everything, but zirconia a couple things can look way too opaque and then also have that mother of pearl appearance to it. So you've really got to be on your A game, I think, in the zirconia world, but that's another subject. Let's get back to this one. So matching a single central, the hardest thing to do in dentistry came from PFM days, and it was because they had to use the opaquer ceramic to block out that very dark black metal, dark metal. And so anyway, now that we have opportunities to switch these things out, they're not that hard. And I would say the first thing you look at, besides shade and value, and those are important, but not A1, A2, A3.
Right.
Are those teeth translucent or are they opaque? Right. So in this particular case, are they translucent or are they opaque?
Well, and again, it's kind of tough. You know, he has more translucency because if you look at his number 10 is very translucent.
So the way where I look for translucency in dentists, we get so hung up on like the translucency on the size, not that. The translucency in the body position, right in the heart of that tooth. So if you look at all of his teeth, other than the PFM we're getting ready to switch out, he has translucent teeth. You can see like on the line angles of the central or number 10, the 2-2 for international viewers. This is translucent. So our guidelines that we do when we see a translucent tooth, we are going to use one of the blocks that has much more translucency. That would be a Trilux block, a real life block. The
Empress Multi.
Well,
block?
no, the Empress Multi are the ones we're using. They're slightly more opaque.
With gradation of colors.
Gradation of colors.
As you go to the edge,
yeah. So stay with me on this video, okay, Cindy? No, actually, our next video we're talking
about,
we'll talk about that one.
Yeah.
The NC block, where basically it has that translucent zone and the more opaque parts of the block. So in this case, this guy is dying for a Vita Trilux Forte block, for sure. This is actually fairly straightforward with this block. The other thing I would say is that on a PFM like this, you're going to prep more because we want thickness of the ceramic. And also, I know we've all been trained that we can maybe block out the stump shade with the cements. I totally disagree with that. And
you're risking, you're risking a lot with that just in hopes that it will.
Exactly.
And then it don't. And then what?
Right.
You know,
so block out the prep with whatever block out composite. I don't even know what's the brand
we use like Flow-It Opaque.
Okay.
You know, and it's not white, it's just a neutral shade, but it's really opaque.
Yeah, I don't even know the brand. So yes, that's
it's like
what she
Pentron or something. Flow-It.
So get the preparation down first, and then everything else will be a lot easier. Okay, so let's move forward. This gentleman, he only came to us because of this one crown. So he didn't want us to fix anything else, except I did fix the abfraction lesion on number 11, but he only wanted us to do this. So I when he came in, he said this, and this, and this. And so I stepped back and I said, okay, the first thing we have to do is we have to get that PFM off.
Yep.
Let's get it off. Let's get it looking better. And so we just used BioCopy and duplicated his PFM, and we used, what do we use for that? One of the composite blocks.
Yes.
Lava Ultimate.
Lava Ultimate, yep.
Yeah, and not that, I mean, it doesn't look too bad, but you can see the temporary cement through it, okay? So it does have some translucency. It's looking better, but mainly psychologically, this guy needed this crown off.
Right.
And then because we know what that color is, we can bleach now and then track him. And he has some way to check that out.
Yep.
So he did bleach. You'll see it a little bit more later, but basically a 1M1. I think this was an A1 when it came to the Lava Ultimate. You can, and right now you coach them also on their translucent nature of teeth, and you're really good with bleaching.
We talk a lot with patients, not necessarily about colors, because if you let them look at A1, B1, C1, and you're trying to explain to them about colors, we go more in depth about what is translucent and what is opaque and what that means, because you can get all those colors and they don't really know what color they want. They just know that it doesn't look lifelike, that their other teeth, it stands out, you know. And so we talk a lot, and I have very translucent teeth, so it's good that and I bleach a lot. So to be able to compare and talk to them about, okay, you know, I've bleached my teeth, here's the difference in translucencies and opacities. And so it's more coaching them on that part versus, okay, do you want an A1, which is a natural shade, or do you want a bleach shade? They don't really know what that means,
well, and
really.
just came to mind, you know, somebody that has very translucent teeth. Again, if you look at his teeth just in this slide, like his number 7, his lateral, look how gray it is all the way up into the body of the tooth. He could bleach for weeks and weeks and weeks, months and months and months.
Yep.
And if he hasn't been coached on the nature of his translucent teeth, he's going to wonder why, well, how come my teeth aren't getting as white as yours?
Mine,
well, it's not that. It's just that the light sucks into
through.
the enamel.
Yeah.
So anyway, lots of coaching more than anything. All right, so we had him in a temporary for, I don't know, like a couple months or something while he was bleaching. And just kind of came in. So this is a little bit of the video on when we just did the BioCopy to switch it out, and you know, more subgingival. You know, you want to get that margin subgingivally. And if this, I don't remember if this is a root canal treated tooth. I don't remember, but let's say it was. The more subgingival, especially on the facial and going into the mesial and the distal, you can get, obviously without violating biological width, the more likely you're going to be able to cover out that dark root through the gingiva. I'm going to pause this. So as that's, like I have it in my own tooth.
Right.
Like my number 9 has gray shit. Don't look at my tooth. She's like,
I'm like, yeah, we need to help.
well, and sometimes you can't avoid, right. I know,
You can, and so it can be disappointing when you go through all of that and then you still see a little bit of that, you know, darkness, and not everybody shows that. I mean, Dr. Ehrlich, unless you're really like looking for it, but a patient is going to be in the mirror and they're going to be looking at it.
Why is my gum gray? You know, that type of thing.
We got rid of the metal. Why is it still like that?
If anybody went to LVI, Bill Dickerson did a great little thing called the Dickerson Ditch, where in the preparation you drill out. This is a whole nother. We should make a video on this very thing.
Like right up at the margin, and then you fill that.
You don't go past the teeth, but you're going way below the gum line, and there's a ditch that goes all the way around, and you're just trying to get to where you're not going outside the tooth boundary. And then you use the flowable.
Okay.
Dickerson. Have I not told you?
No, but I like that. What a catch. Yeah. Well, no, I've seen you do it, but I didn't know it had
Bill
a fancy
Dickerson,
little
LVI,
name.
yeah.
I like that.
Big pearl for there. It works really well to keep the gray. Anyway, so we'll go back to the software. And in that Trilux Forte block, just for historical reasons, Trilux was a block we've used for years and years that only had 3 layers, and now Vita makes the Forte block. The Trilux block, I think, is discontinued, but we have now four layers to it. And you know what, I've done so many of these. Nobody can see the layer.
The lines.
You can't see the lines.
No, and we hear it all the time. But if we use that, you can see the layers. You can't see the layers.
No. So feel comfortable about doing it. Also, moving it up and down, it's in your nature, like you want to move it all the way in the translucent zone. Well, if you're moving it all the way up into the translucent zone, that translucent zone, in my opinion, is the most translucent of all the blocks, other than the Opal line from in Emax, is the most translucent area. So you don't have to just jam it up there because, Dennis, you want translucent. Because this is the whole block is translucent already to some degree. So don't feel like you have to jam it all the way up. It'll still look really good. All right, we'll move on forward. So, at this point, that would be maybe a little too much for this guy. This Lava Ultimate Temporary, we told them, come in, we'll just switch them out because we already had the crown design. We already knew the shade because we checked the progress along the way. And I couldn't get the temporary off.
It wasn't coming off. We wasn't worrying about that thing coming off.
And
so we cut it off, which is fine. I mean, to have to do that.
But he wasn't numb, which not a big deal. He was doing fine. And then this is really critical because you got one more opportunity, and this is with the cement. This is to modify basically the value now, so how bright it is. And we use VeriLink Aesthetic on this. And
which I love. I love VeriLink Aesthetic, and because the try and paste and the cements are, that is the color. So when you put that try and paste in there, you can feel comfortable that if I'm going to use warm and this is the try and paste, this is exactly what the restoration is going to look like. There's not shade shift, and there's not, when you cure it, it looks exactly like the try and paste. And I like too, one is black, one is white, so you're not going to mix up and accidentally use cement for the syringes and use the cement when you're meaning to use the try and paste. So Ivoclar's done really well with this line, I think. I like it a lot.
We one way we use it, like when we're doing full veneers, veneers are so emotional. There's so much emotional attached to a veneer. So you have to do this in a gentle way. So we'll always start with a warmer color, or maybe even the darker color, even though we know that's not what we're going to use, because to get ownership from the patient, they need to see what that is and say, okay, are you okay with it? Or you like it or not? We can move you up one. But if you just start with what you think you're going to use,
whitest, don't
and then they look at it. That's their baseline reference, and they go, and every American patient wants whiter. And so now you're stuck.
And especially females, and so we always start with the warmer shade, and then we both, get up and look, and, no, we need to be a little bit lighter, and then you can always go with the lighter shade as you move up, but always start warm and go lighter.
Yeah, on a single central, though, I think probably you just go for the one you think it's going to be, and then you can go up or down slightly from it. All right, move forward. Yeah, so the VeriLink Aesthetic, it looks so much like the try and paste looks so much like the resin. They come in different colors, so you got to make sure you keep those straight.
Yep.
I'm a big believer in etch. I want to see it etched. I feel better about it being etched. I think we get contamination off with it. I think there's a lot of uses for etch. And the other thing, I don't like placing cord and a lot of lasering, because I think we're just asking the gingiva to bleed. Why would I do that if I don't want it to bleed?
At a moment, that's the last thing you want to happen right now, is any kind of blood or moisture or anything like that. You want to feel good about, okay, I'm putting this in, I'm not worried about the bleeding. So
obviously, if the gingiva is over the margin, then you got to do something about it. But if it's not, it's just sitting right there. Why mess with it? Nothing's going to happen to it. You can dry it, and it'll be okay. Adhese, I love Adhese. It's just amazing product, and it's self etch as well. But I still use an etch. I like it. One of the complaints or thoughts we've heard on the Adhese is that it changes the value of the restorations because it's yellow. There's no way. This is so translucent, and just to prove it, you paint something, cure it, look at it. It may have a slight little yellow hint to it, But this is so thin,
yeah.
it's not going to have an impact on your overall color. No way.
Yeah. The delivery of it's awesome, and it's so easy to use. I love it.
Paper, you got to blow this thin because we want to get the solvent totally air dry and really, really dry. We use an Optragate, and then this is Cindy's favorite light because it's pink.
Must have pink.
It only works with
The patient's glasses are pink, mine are pink, the bib is pink, the curing light's pink.
Yeah.
I mean, it should
It will not work
match.
any other way.
No.
Okay, so we'll drive this crown home, and another mistake I think when people are putting onlays too, they don't use
yeah.
enough resin. Like they just want the tiniest little bit to come out. No, I want enough that I can grab onto it.
Yeah, because the good thing is once you tack cure it, that whole little rim, you just grab it and it pulls off kind of as a whole.
Right.
So it's not harder to clean up, and then we know that it is on there and there's no voids, and like you said, mostly with onlays and stuff. I mean, you want to make sure that you have a rim all the way around that margin when you put it in, and then you feel good about how much resin you have in there.
And what's the worst that happens is you over cure it and you got to polish it back. I would much rather have to do that than get brown staining the margins, or God forbid dislodging the restoration.
Sensitivity.
And dislodging veneers is a nightmare when you have partially polymerized resin and that thing flies off or whatever. You got to start over.
You're starting over.
You were starting over on that. I mean, so I don't even want to get to that point. When you saw me cleaning this one up, that gel phase is still a little bit runny for me. Most of the time I'll cure it just a little bit more because I'd rather have it just a little bit harder than that. But the next thing is you got to cover that oxygen inhibited layer, and you can use glycerin. Obviously, you don't want to use water. Honestly, I just take the adhese because that adhese has been sitting there, and so if you think of that little tip, there's resin still in that little sponge at the very tip, but the solvent is probably pretty much gone, and then you just rub it off. You can kind of use it to clean things up.
Yeah.
Then finish up the curing. And again, if there was a cord, if you like cord, use cord. I'm not trying to keep you from doing that, but my opinion is when I'm kind of pushing things around, I don't want to disrupt anything. So.
And I used to love packing cord, and when I told him that, he goes, "So it's like taking something and jamming it under your nail bed." And once he said that, I was like, "Oh, I was really mean that I actually enjoyed doing that."
That is twisted right there. Yes.
So messed up.
All right, so we'll get this cleaned up. It's probably like 80% cured at this point, and obviously Cindy's holding it down as flossing through, and I'm not real worried about a contact getting bonded together. Again, I'd rather it bond together than dislodge the restoration.
Yep.
Sari saws in different ways, you can separate these pretty easily. We don't use very many burrs to clean these up because we're careful about the exposure of the resin going everywhere. So we just use a little flame diamond burr, a greenstone sometimes if we're going to adjust occlusion, or if there's a bulk part of cement, you can use it. Who's the company that we buy the greenstones from?
Oh, Shofu.
Shofu, and then that's where we get the brownie points too. This guy's talking to us as we're getting this out, and anyway, so what we'll see here is the before and the after. Again, using the Trilux Forte block on this will have much more translucency. But with an endodontically treated tooth or a dark stump, you still want to cover up the body. So when you look at number 8 versus number 9 still has a little bit more translucency, but I would much rather err on it being slightly too opaque right in the middle of that restoration to block that out.
Block that out, yeah.
Okay, so in another video, we're going to talk about the other block to use if you're going to match single centrals, and that is the multi-block from Ivoclar Vivadent.